when performing the examination on the hip, you always want to do range of motion. And one thing that you want to look at is how the hips move during their range of motion. One very simple tool to see if the hip flexors are tight is to have the patient do knee flexion. So when they flex the knee, you want to look at the positioning of the hip. Okay? When they flex the knee, if they flex the hip at the same time, then that could point to these hip flexors being very tight. Now you may notice that when they're standing. You could also do it when the patient is prone. Patient's laying face down. They may do it active or passive when you're doing it, or even resistant. If the hip flexor is tight, what that patient is going to do is lift the hip flexor. They're going to lift the hip up backwards, contracting the hip flexor when they're flexing the knee. So you want to look for that. That should not occur during normal knee flexion. You should see the hamstring contract, the glute contract, and the muscles in the low back contract, but there should be very minimal or no hip flexion. So you want to look at that when you're doing the examination.